my name is Dr. Shohan Pervaze. I'm a PGY2 at Norton Community Hospital. This is a case of MRSA Bacteremia secondary to MRSA UTI bacteria. So I thought this was a pretty cool case. The prevalence of MRSA bacteria causing MRSA bacteremia is pretty low. So I just wanted to kind of present and kind of talk to you guys about this case that we saw. So if you could go to the next slide. So this was a 64-year-old male with past medical history of uncontrolled type 2 diabetes mellitus. Patient's hemoglobin A1C was greater than 12 at the time of presentation. History of BPH presented to us initially due to altered mental status. Of note, which is highlighted here, patient has history of some urinary symptoms requiring catheter in the past, and the patient actually presented with the urinary catheter in place to the ED. And of note, that was recently changed approximately 1 month prior to presentation. Patient was following with urology due to this problem, but at the time of presentation, he still had that. Of labs, as you could see, patient had a pretty significant glucose of 1582 with worsening kidney function. And UA was notable for ketones as well as glucose assurance, so pretty significant for UTI presentation. So we ended up admitting the patient to ICU for HHS and as well as UTI treatment. So initially we went ahead and did a typical workup for UTI as well as HHS. Eventually blood culture was obtained as well as urine culture, which both grew MRSA bacteria. So given that we had the patient on appropriate antibiotic coverage for MRSA bacteremia as well as MRSA UTI, which was vancomycin, and we kept the Foley in place and continued to monitor his urine output as well as overall progression. However, you could go to the next slide. However, the repeat blood culture, which is typical we need to collect, continued to be positive despite being on appropriate antibiotic coverage. And the culture sensitivity kind of showed that the patient was on appropriate antibiotic. Given that presentation, we kind of got other imaging such as CT of the abdo-pelvis without contrast that you see on the right top corner to see if there was any kind of abscess or any other source of infection that we were not like really focusing on. And just a part of the CT imaging that you're seeing on the right side. And it was pretty benign initially. And we continued to kind of look for other sources of bacteremia, basically. So we had done an echocardiogram, which initially showed possible concerning for endocarditis. So we ended up doing TEE to rule that out, and it was ruled out. So there was no source. So we were kind of like, just trying to find what is the cause of this persistent bacteremia. And UA as well as urine culture remained positive at that time. And during this time, intermittently, we had ended up removing the Foley catheter because patient was producing urine, and once upon removing the catheter, patient will continue to urinate routinely and regularly without any difficulty. So we thought that wasn't a problem. We had done a pretty thorough physical examination to kind of see if the patient was complaining of anything at all, any pain, back pain, or anything like that, that could be, giving us indication as to what is the cause or source of this bacteremia. And there was really nothing. So we ended up kind of doing a pan scan, which was an MRI of thoracic and lumbar spine. And what you see on the right bottom side was his bladder. Even though he wasn't really complaining of any kind of pain or any kind of discomfort, and he was actually producing urine, his bladder was pretty distended, as you see on the right bottom side, and there was a lot of urine. So we ended up putting a Foley catheter in and extracted, I think, almost 2 liters of urine. So eventually, the blood culture started to come back negative, and he started to improve as far as overall progression. And we ended up discharging the patient with a PICC line with continuous IV antibiotic, which was vancomycin. So this was kind of a weird scenario as far as the presentation. So we kind of hypothesized that patient probably have diabetic neuropathy leading to overflow incontinence. So he was making urine, but there was a lot of retention that we weren't initially kind of noticing. So this case kind of, what I want to focus on and kind of talk about, if you could go to the next slide. When I'm going to talk about the importance of physical examination and kind of looking through everything. So bacteremia itself is kind of tough to, especially MRSA bacteremia is kind of tough to detect sometimes, such as this presentation. As you see on my first bullet point, the prevalence of MRSA bacteria is pretty low. It's almost approximately 0.2% to 4%. But in patients with other comorbidities such as long-term care, some sort of urological abnormalities, such as this patient, male patient apparently are more predisposed to this kind of bacteria. So again, I think it is important to kind of notate that like good physical examination, proper history taking is very important treating bacteremia, and obviously you have to have a stepwise approach. We have to have a negative blood culture to kind of complete the treatment protocol. And on the right side on that diagram, you kind of see some of the risk factors that are associated with MRSA. Again, there are some environmental risk factors as well as infection. So that's my presentation. Any question?
So I think at the beginning you mentioned that the patient was also treated for urinary retention with previous catheterizations,
Right.
BPH. Do you think in addition to the diabetic neuropathy that you guys suspected, do you think that has a role with the way the patient had MRSA in the urine?
Absolutely. I think, because like that was kind of the thing that we were also kind of monitoring. So we had changed Foley catheter right away, even though it was changed prior to presentation. We kind of cultured that as well to see if that was kind of causing it. But again, the blood culture remained persistent. And I do think that's a risk factor in this patient that kind of contributed to the overall picture.